An inversion table like this one is often seen as a treatment option for back problems like herniated discs, lower back stenosis, lower back arthritis, and muscle spasms in the lower back. But does inversion treatment therapy really help? How is it used? And how exactly does it work in the body? In this video, I'll be giving you my honest physical therapist opinion about this specific inversion table, and I'll also be answering the question, is an inversion table helpful for back pain? Let's answer the question of how inversion therapy works for back pain. And when you flip the body upside down and you're holding on by the legs, by the ankles down here, you're using the upper part of the body to take pressure off the lower back right here. And in the lower back here, you've got discs that often get herniated. You've also got joints that are right here where I'm trying to put my fingernails in. You have pairs of them at every single level. You also have nerves in the area, muscles, tendons, ligaments. There's so much in this area of the body that can become injured. And when you take pressure off, you allow it to heal. Because what this part of the body is designed to do is transition forces between the upper body and the lower body. So whenever your legs are moving, like you're walking, you're exercising, you're doing things around the house, you're bending over, standing up, carrying things in your hands, especially heavy things, weightlifting, all those forces need to be going through this part of your back. And as you can see, there's only 5 bones here, the 5 lower back vertebrae, the bones between the pelvis and the rib cage, and of course the legs and the upper body. So there's many opportunities for extra compression, for too much pressure to go through this part of the back. So by hanging upside down, it's a nice, passive, easy way, as long as you don't go for too long and you're not too vertical, which I'll tell you exactly how to do it right. It's an easy way to get pressure off all those structures, all those tissues, all those different parts of the lower back. Specifically, it gives those muscles that are working too hard, like with a muscle spasm, a break. They're usually clamping down, working extra hard to provide stability for the spine because it has to be upright against gravity. But if you're hanging upside down and you're taking gravity off, then they don't have to work so hard, so those back muscles get a chance to relax. If you have a herniated disc, these things right between the bones, those can become injured because of too much compression in the area. Hanging upside down takes that pressure off and puts them in a position to heal. And if you have problems with the joints in your spine, those would be the ones on the back side right here with how they move. Those joints can often become compressed also from muscle imbalances, from muscle spasms, from other issues happening, and taking pressure off helps those joints to move better and breathe better. And then of course the nerves here on the sides of the spine, whenever the joints get compressed, the discs get compressed, those nerves come out through openings made by the bone above and the bone below. So if you can gap or spread apart those bones just a bit, at least for a short time, you can begin to get some short-term pain relief on those compressed nerves. Now, some warnings about using an inversion table. If you have eye problems like glaucoma or other pressure eye-related issues, you might consult your doctor, your eye doctor, before using an inversion table. If you have high blood pressure or other circulatory problems, and if you have ear problems, especially pressure ear problems, talk to your doctor, the one that's taking care of that specific problem, to ask them if it's safe to use an inversion table for your back issue. And some other notable ones is if you suffer from chronic headaches, watch out on going too far upside down because all that blood rushes to your head the more down you go, and that can set off headache problems. And also if you have increased back pain while beginning to use the inversion table, even at the lower settings, then it's probably not going to be beneficial for you to use it for more time. We'll talk through more about exactly how to use it in a safe way towards the end of this video. Let me tell you about this specific inversion table by Innova. We got it off of Amazon. If you're interested in looking at it, you can find the description in the link below for this specific inversion table. This inversion table is rated to support 300 pounds. It comes with this padded backrest here and headrest as well. We've got these long padded handles on each side. They're very sturdy. The whole design is very sturdy, and it's got the footrest down here with an adjustable clamp for the ankles to hold you in when you're upside down. And then you have this stem right here, this bar that you can adjust depending on your height. So you can slide that inwards and outwards. And I'm just going to scoot this over sideways. You can tell it's very light when I move it over here. Right here we've got the settings to adjust how far this can invert. So right now it's at 5, which is the steepest one. So if I flip it up it's going to go pretty much all the way upside down. At this angle here, it feels like all the blood's rushing to your head. It feels the most extreme angle. If I move it to a lower setting, let's say all the way to the other end to number 1, and you got to screw this in. I'm not going to screw it in all the way just so that you can see. It's going to stop you at about right there. So it's a very light amount of inversion that you're doing here. And of course, the other numbers in between, that's a number 1 on mild, and the number 5 was steep. So if we go for the middle one, number 3, it's going to go halfway between the two. Now you've also got a pin here, a safety pin. There was a chain. I accidentally broke the chain so that you don't lose the pin. It's just to keep the legs of the device open so that it doesn't move on you, because you can fold this away. It folds upwards like this, and that way you can store it away if you need to. And that way the pin, the chain's supposed to be hanging on here so the pin is available. You can't really put the pin anywhere. I guess you can put it in here. It doesn't stay in as well. Oh, right here. There you go. That's where it would go. And when you go to open it and set it up, you would take that pin out, of course, open the legs out, make sure to put this pin back in, and now it won't close on you. And one of the neat extra features about this table that's unique compared to other inversion tables is that it comes with this device here that is a heating and massage pad that you can attach to the table so that you can get some heating going, and the little machine starts to rub your back while you're doing the inversion. So I'm just going to clamp it in place. So I've secured the pad on here so you can see what it looks like. Let me angle this towards you more. And it's got this remote that you would just put out to the side when you lie on it. And then it's got a power button. Let me turn it on. It's already going into the vibration right there, so it's massaging your back. You can adjust the intensity of it, make it more intense like that. There's the lower intensity. There's a button for heat. Just takes a minute to warm up. I've already tried it out. And then manual. I'm not really sure what that button does, but there's different settings on this, pretty simple to use. And I thought this was a nice addition for this inversion table. Now let me give you my pros about this table. Obviously I love this little pad here, and honestly I was kind of worried that this would make it too thick to lie on, but once you get on it, it's actually quite comfortable. It's got some give to it, and it doesn't feel like it's really bulky and making your back arc. It actually feels really nice. I really like this pad here. Another pro is how sturdy this thing is. I've been on inversion tables before that just felt more rickety, and I'm a bigger guy. I'm 6'2", I'm over 200, I'm 225 pounds, and I felt very secure on this. I even moved around and did some exercises while hanging upside down at full inversion, and it would make a little bit of noise, but it didn't feel rickety or like the whole thing was wobbling. I felt very secure while upside down on this table. Other tables that I've used too don't have a big padded cushion like this or headrest. They're usually just a plastic frame, which I hadn't really compared, but once I got on this one, this is super nice, especially because I usually tell people not to go full inversion, but more like this. While you're hanging out at this position, you're still resting on the backrest quite a bit, because when you're fully inverted upside down, you kind of come off the backrest because you're more like dangling. So I appreciated the backrest here and the headrest. It's quite comfortable. I also like the pin system right here. This right here where it limits your motion. I've seen some tables, some inversion tables that have a strap that you would tie to like right here, and then it ties down to the frame. And I don't know, I just don't feel very comfortable with the strap. I feel like it can give, especially if it's one of those adjustable straps that you slide the strap in and out of a plastic piece. I feel a lot more comfortable having a pin like this that screws into place and it's not gonna move, just so that I have complete comfort when using an inversion table. I also liked the ankle clamps here. Now, this is pretty standard on most of them, but it's just really easy to use. I like the pads, the way they kind of move around and they slide in and out, so they adjust for your leg position and your ankle shape and size. And this pad right here is a little flat too, so you feel comfortable when standing on it. I also enjoyed the long handles, these right here, that go all the way down, kind of out of the frame there. Can you see them there? They go all the way down, so you can grip it from many different positions. I feel like I always have a handle, whereas some of the other tables I've seen out there have a shorter handle, just about this long. which, when I used those tables, I felt okay. I just got used to the table, but I did appreciate these nice long handles. This table does fold up, so that's pretty cool in case you need to store it away, because it might be that your back's feeling better and you don't need to have it out and it's taking up so much space. So you can put it away in your garage or a closet. And if you needed to take off this pad too, you can. It just unclips and you can take it off and use it without the heating and massage pad. Now, some cons about this inversion table is that it is bulky. Even when it is folded away, it doesn't fit in a closet very easily. I mean, you have to have a pretty big closet or a lot of space. But that goes with just about any inversion table. And it's kind of a trade-off, because if you get a lower profile inversion table, it may not be as sturdy or as secure. It may not come with as many features as this one. So that's a bit of an issue. Now, this did require assembly. It took about 30 to 45 minutes, definitely not more than an hour to assemble. But an upside of that is it came with all the tools needed to assemble it, so you don't need to have any extra or special tools in order to get this set up. Now, let me give you my honest physical therapist opinion about this Innova inversion table. I really like it. I think it's definitely worth the value. Coming in at about $200 or under if you can catch it on sale, it's a fantastic value. Once we had this set up here in the clinic, I actually had a workout that morning, a weightlifting workout, and my back was feeling a little bit stiff. Hadn't used an inversion table in a good while. And so I went to test this one out to see how I liked it and how it moved and all that. And I hung on it upside down, not all the way. It was on the number 3 setting. And it was on there for 10 minutes, and my stiffness in my back went away completely. So it felt tremendously better. Still hasn't bothered me since. But that's just my personal experience. I haven't really dealt with much chronic back pain. Now, I've had many patients over the years that have had all kinds of chronic issues, disc herniations, of course, arthritis, stenosis, all kinds of other back problems, ongoing muscle spasms. And the ones that have used inversion tables, I can't say that they've used this one. They haven't told me the specific brand that they used or the type that they used. But the ones that have used inversion tables across the board, they say that they can find short-term relief when hanging upside down on an inversion table. And I generally tell people to go hang like off a pull-up bar or a dip station or one of those devices where you can put your elbows and hang your legs, because that can also provide you with distraction or decompression in your lower back. But this is a good option for if you don't want to be as active, if you don't have the upper body strength to do that. This one, you just clamp your feet in on the bottom part and then you flip over and you can hang there. And it's also more gradual, so you can hang on this for longer periods of time than you would probably be able to hang or dangle from your elbows. Now, I'm a huge proponent of getting that upper body strength. I think you should get stronger, but maybe you're not there yet. It's going to take you some time. You'll work on it eventually. This is an option for if you can't do that, or if you just prefer something that's a little more passive, where you can just lie on it and relax, and maybe even get a little massage and enjoy some heat on your back to get some nice, much needed back pain relief. So next, let's talk about how to use an inversion table, how long to use it, how many times a day to use it, how to adjust it. Let's go through all of that next. So step number 1, you're going to want to make sure that this is on even ground. You want to make sure that the surface you're on is even out. You can see how I've got a part of it on the carpet and off the rug here, but it doesn't wobble. Oh, it kind of does. Move it over just a bit. It doesn't wobble too much for me here. For the purposes of this video, don't try this at home. I'm going to keep it here. But you want to make sure that it's not on a very thick rug or something that's going to slide. Make sure the ground is secure. Next, you're going to want to make sure that you have your setting on right here. So for this device, it's got this nice pin, this big metal pin that you can put in. If this is your first time using an inversion table, I would encourage you to put it on the least steep setting. So this one has a number 1 that says mild right there. So it's only going to allow you to go that far. It doesn't go any more than that, just so that you can try it out and make sure that it's okay for your head, for your back, for any other issues you might encounter while hanging upside down on this. Next, you're going to want to adjust this bar right here according to your height. So I'm 6'2", right now it's on 6'1". Now there's a pin right here that you just pull out. It's a spring-loaded pin. So it's good. As soon as you let it go, it's going to go back into position. And you can slide this bar in and out this way. You get it to my height. It's at 6'19". And wait, 6'6", I think it was. Yeah. So I went on 6'2". It's telling me the centimeters. It's got centimeters on this side and inches and feet on this side. So now it's at 6'2". Now, quick side tip is make sure you can tell time when you're on the table. So wear a watch, or make sure that when you flip upside down, you can see a clock somewhere and note the time. Another option is to set a timer on your smart speaker. So now you're ready to step into the foot clamp here, the ankle clamp. And I'm gonna lean onto the backrest here, get my feet in position, the back of my ankles on these pads. These are really neat. They slide in and out to adjust, and they roll this way. And same with these. These can roll and adjust a little bit side to side. Once you're in position there, you just pull this pin up and it locks at different settings. And I'll clamp it down firmly. Once your ankles are locked in and you have all those settings set, now you can grab these handles, lean your head back, and push yourself into inversion. And that's where the table's gonna limit me. Now I like to hang my hands overhead right here. Keep an eye on the clock. If this is your first time, you're just gonna go 1 minute, see how you feel, make sure you're doing okay, make sure your back's not getting any worse, head's fine. And if you feel fine after a minute, you have two options. You can, number one, add more time, or number two, do more inversion. You do what you're most comfortable with. If you decide to add more time, I would encourage you to only add 2 minutes at a time, and you don't need to do more than about 10 to 15 minutes in one sitting. If you're gonna add more inversion, it's okay if you jump up 2 spots here, but number 3 is gonna be a little bit more significant, so just watch out going into 4 and 5. Let's try number 3. Now I'm set for number 3. Let's go ahead and flip over. Now at this angle, it's gonna stop me about right there. Now, this feels like a very good amount of inversion for me. It's not terrible. I can feel a little bit of blood rushing in my head, but it feels tolerable. I feel like I can hang out here just fine. And I'm pretty balanced. One thing I didn't mention is I'm more torso than I am legs. In other words, my upper body's longer than my lower body, relatively speaking. So you might need to adjust the height accordingly to you. If you're more legs than torso, you might actually need to make it a little bit longer. For me, making it shorter is probably gonna give me more control going the other way. Just play around with it, see what you like. And then, of course, you've got this option to use the massager. Oh, that feels nice. I'll turn on the heat as well. And now I can just keep an eye on the clock and go for 5, 10 minutes, 15 minutes if I feel comfortable doing so with my head. And it's okay to take breaks. If you feel like your head just needs a short break, you can flip and just hang out here for a minute. And see, I feel pretty balanced. I don't need to hold on very aggressively to keep this position. Or I can come all the way up, of course, if I want to get my normal back again, the normal weight on my body, and then go back into inversion if I feel like I need to go another 5 minutes or 10 minutes or whatever it might be. Now let me just show you number 5 setting here. All right, we're set for number 5. Let's go full on inversion, the limit of what this table allows me to do. So you can see here, I'm going well past 3. My arms have to go into the frame. And now I'm coming off the backrest. I'm still on it. I know I'm not perfectly vertical. I'm still at a slight angle, but I feel a lot more pressure through my ankles. But it's holding me up pretty well. I feel like I can wobble around. This table's pretty sturdy, and the angle is quite intense. Now I don't think that you need to do this to get the relief you're looking for. A 3 setting, maybe even a 4 setting would be probably more than enough, because you can last longer there. Here, I don't feel like I'm gonna be able to last more than a few minutes before the blood's gonna be rushing to my head too much. I'm not dealing with allergies today, but that could be a factor too, all the mucus going back up into your nose. Now keep in mind that using an inversion table is only going to provide you with short-term relief. It's going to set you up to heal, but there's other factors that you need to consider when looking to heal a back problem for the long term. Let's talk more about that. Most chronic back problems like lumbar stenosis, herniated discs, lower back arthritis, muscle spasms, and pinched nerves, even sources of sciatica, share the same common root muscle imbalance. Here on this channel, we have videos that talk all about how to fix that root muscle imbalance, where to start, how to get long-term relief. You can go check out our playlists on those specific conditions. We have tons of videos on each one. They're down in the description below. You might also want to learn more about our 28-day back health and wellness boost program, which is designed to address that root problem so that you can achieve long-lasting optimal back health. Hey, this video was helpful for you. Please give us a thumbs up and don't forget to subscribe and hit that notification bell so that you don't miss out on any of the helpful videos we have. Please share this with somebody you think needs to hear about this, and I hope to see you in the next video. Bye-bye.